Et c'est une très grande chance d'accueillir professeur Li pour la communication suivante. Et je propose que les questions les fassent après les deux communications, si ça vous convient.
Merci à tous. Parce que je ne parle pas bien en français, donc je parler mon topic en anglais. Distinguished chairman and all of the professors, it's very happy to be here and have the topic about the pink ribbon and prevention and treatment of the tumors in China. So I have a four part. The first part about the pink ribbon in China. All of you know that October 1992, Miss Londi and Miss Penny jointly launched the pink ribbon as a symbol of the global campaign for breast cancer prevention and advocacy. The main objective is to raise the public awareness of breast cancer and promote early prevention, early detection, and early treatment. So in October 2003, a pink rainbow yacht was inaugurated in Shanghai on Huangpu River in China, marking the official entrance of the movement in China. From 2005, the campaign gradually expanded across the entire country. You see, it's kind of the pictures, some of the company and some of the famous men and women to participate in this kind of the activity. You see, after that, October is officially designated as Pink Rainbow Month. Numerous hospital, non-profit organizations, and enterprises across the country carry out promotional activity in different kinds of the forms. So, such as a film star serve as ambassador for the Pink Rainbow Public Welfare Campaign. Public service announced video produced landmarks are illuminated in different kind of the country, different kind of the city. This picture is kind of the film star. Her name is Li Bingbing. Served as ambassador for the Pink Rainbow Public Welfare Campaign. You see in different the cities in China, Beijing, Shanghai, Hangzhou, you see different public places. You see in Beijing, we call the water cobble. It's illuminated. So Shanghai also is Oriental. We call it the Shanghai Oriental Pier Towers, have the pinks. So you see on-site voluntary medical consultation in hospital, in some of the community places also. And the medical science popularization conference in university, in the hospital, or some of the district. And then there is a healthy running. After that, I will introduce something about my hospital. So the second part is a screening program for two major cancer. It's a breast cancer and cervical cancer. You see, recently in China, the cancer increased repeatedly. Before 2024, the first cancer in female is breast cancer. However, in 2024, the first cancer is lung cancer. The second is breast cancer. The incidence of the lung cancer is 40 per 100,000. In breast cancer, it's about 35 per 100,000. I will talk about a little about the National Cancer Prevention and Treatment Awareness Week and the National Cancer Day in China. In 1995, the Chinese Anti-Cancer Association launched the National Tumor Prevention Awareness Week. It is held annually from April 15 to 21. In 2018, the Chinese Anti-Cancer Association designated April 15 each year as China Cancer Day. Until now, it is the 31st times. So it's a number about numbers activities for 2025. You see the scientific activities is more than 21,000, and there are some of the peoples to know the knowledge from the media is more than 1 billion. Now it's some kind of the pictures for the celebrating of the anti-cancer weeks. And in different cities, we have organized different kind of the forms to do this kind of the things. And then also you see. Now I will introduce a little bit about the screen program. In China, for the breast cancer, we have the screen program from the 35 to 64 years old, and the method is mammograph and ultrasound. For the frequency is at least one time in 2 to 3 years. Concern the cervical cancer, we'll have the examine the VPH and the TCT. There is one time per 3 years. From 2009 to 2023, covering 31 provinces and more than 2,000 counties have the screened. A total about 290 million cervical cancer screening and 190 million breast cancer screening was conducted. The part 3, I will introduce some of the education program in my department. You see the pictures Professor Madeleine and Professor Wisha participated. It's kind of the ribbon, pink ribbon campaign. In 2023, also in 2025, you can see we have the celebrated this kind of the activity. We have the health running. The slogan is cure breast cancer. We organized our patient and some of the volunteers to participate in this kind of the activity. So also we have the medical science popularizations conference. You see, we have the on-site free medical consultation in outpatient department in our hospital and some of the district also. So for the patient, we have the program of about the post-treatment management and the habilitations follow-up for patients. And the 4 parts, you know, for the tumor prevention and control, sometimes it's difficult. So it's crucially significant missions. Actually, in 2022, according to Chinese National Healthy Center reports, China's recorded approximately nearly 5 million new cancer cases and about 2.5 million cancer-related deaths. So the standardized 5 years relatively survival rate for breast cancer during 2019 to 2021 was 80.9%. So that is the reason we have the three-level prevention strategies. The first is the cause prevention. The second is early screen, early diagnosis, early treatment. The third is standardized treatment, rehabilitations, management, palliative support. So you see for the anti-cancer, sometimes it's difficult. For the fight against the cancer, we faced the serious challenge. Anti-cancer is not only in April or October, but in every day. We are pay attention to the early prevention, early detection, early treatment. Thank you for your attention.
Thank you very much, Professor Lee. Thank you very much, Professor Ren. We have time for one or two questions. The question is for all two, Professor Lee and Professor Ren. You promote early diagnosis, you promote screening in China, and you promote also preventions. And I would like to ask you, what are the main risk factors for breast cancer patients in China?
October?
The main risk factor. What are the main risk factors? Obesity, sedentarity, what else? Genetic problem? Hormonal?
For breast cancer?
Yes, for breast cancer.
For cancer, I think it's also like in West country or American, it's a hormone related the things it's important. But also it's some of the other reasons such as smoking, fat, and so on. Yes.
OK, thank you. Il y a de la place peut-être pour une ou deux questions de l'Assemblée. Mauricio Magalhães Costa from Brazil.
I'd like to know what's the current recommendation for the screening in China. If is there a recommendation, it's a yearly mammography or biennial every 2 years. What's this? If there is a recommendation for the screen.
Yeah, for this screen program, the density of the breast in China is different from the Western country. The incidence of the breast cancer is about the 40 years old and 40 years old. So that is a premenopausal. But in West country, Europe, most of the cases is the postmenopausal. So the density of the breast cancer is a little higher. So we suggest the patient to have the ultrasound the first. If there are we think there is a lesion or without this cancer malignant, we'll have the suggestion to have the mammograph. The first of all is ultrasound.
OK, vous savez, d'après le résultat de la statistique en Chine, on parlait de morbidité des cancers du sein sur les femmes. Il y a deux pics. Le premier pic, c'est entre les 45 ans jusqu'à 55 ans. Le deuxième pic, c'est repartir les 55 ans jusqu'à 65 ans. C'est-à-dire, mais par rapport aux pays occidentaux, la Chine, le cancer du sein, la femme, le cancer du sein en Chine est plus jeune que les femmes françaises. C'est pourquoi on a fait les catalogues pour le dépistage. On fait les dépistages à partir de 40 ans. On proposait faire l'échographie une fois par an. On proposait faire le mammographie une fois par 1 et 2 ans, jusqu'à la 70 ans. Mais vous savez, la Chine est trop grande, il y a un souci de l'économie. On ne peut pas faire les dépistages par la mammographie régulièrement. En Chine, on fait des échographies et plus mammographie. Merci.
Michel-Henri Delcroix, en fonction de ce que vous venez de dire, en Chine, justement, étant donné la prévalence de l'exposition tabagisme passif, puisque c'est un des pays où les hommes fument le plus et où donc l'exposition tabagisme passif pour les femmes est la plus grande. Est-ce que vous avez remarqué que, justement, vous évoquez les cancers chez les femmes plus jeunes, justement, l'exposition tabagisme passif, surtout si elle est précoce et dans l'enfance ou l'adolescence, eh bien, ça va augmenter la prévalence des cancers du sein préménopausiques.
Okay, merci. Oui, on va faire.
So, Dr. Hao has done this kind of work for the breast cancer screening for many years, and we have developed the guidelines for the breast cancer screening. I think maybe Dr. Hao will give some comment.
So, just now, push a button, please. Doesn't work.
This is.
It's very nice, and at this very special conference, a small conference at the National Cereal Economy, and we have two colleagues give presentation about breast cancer. It's very, very nice. I also add something about the questions. For the breast cancer incidence, after since come to the the new century, so it's come back very quickly. Even the past 40 years. So we have a program for the breast cancer screening from my 40 years. When I'm in a residency. In the weekend, I go with the doctors to go to district and homes to screening. And also we have a program, it's national program organized by the Chinese and public health ministry. So it's the country cover the whole country. And so by that time, up to now, the breast cancer incidence is still much lower than France, than the United States. But it's in the past 40 years, it come up very, very quickly. I think the reason for that, one is the diet. Smoking is a problem worldwide. But in China, I don't know, Dr. Massini, you have been to China. The women smoker is not a big problem, you know, no. And here in China, in the public, there's a law in public cannot smoke. I think it's implemented everywhere is good. But it's a diet, and since we in the past we eat less meat, so but now we have a lot of meat, and I mean the body weight getting up. Another problem is in the past 50 years we have the one family, one child. This is contribute to the cancer incidence coming up in the past half a century, I think. So the policy is just changed. And also, since the young women in the past 50 years, they like not use the mother milk to feed the child. They like to with yeah. So they after give birth, they use not the mother milk. I think this contributed to the breast cancer incidence. And right now, just Dr. Chen and Dr. Li said that they have a good program for the screening. I think everywhere I mean, in the major cities, they start the program. My program that's about 15 years ago. So that's is nationwide. We have a guideline. This guideline is changing. I think everywhere the guideline for screening is changing. At that time, with the year after 45, every 2 years we have mammography, and if you the breast is dense present, the breast with that plus ultrasonography. So that my study is for the dense breast, they can come up another 10% early breast cancer. But in China, I mean, in East Asia, the breast, generally speaking, is more, we have smaller, dense breast. And also, if you have family history or you have black genes and positive from 35 for the, and then the screening become not only mammography, but it's ultrasonography plus magnetic resonance. So, and this is roughly that. Thank you.
Merci beaucoup pour ces précisions. Merci beaucoup, professeur Hao.